and we'll get started. Michelle, I'll hand it over to you.
Thank you, Alana. So I just want to kind of share with you all how this topic came to be, both to kind of give you the backstory of, how and why this work is so important, why our partnerships and our conversations are so important, but also to encourage everybody to have these conversations with partners about hard things, things that are coming up for you all in your work so that we can continue to spotlight partnerships and we can continue to spot everyone's work. So this conversation came about in two different ways, through two different paths. One for me, with my other hat at FIRE as executive director, in a conversation with law enforcement. And that conversation really spoke to a lot of the issues that we're highlighting today. Talking about social service responses, talking about moving people who are in crisis into care, and also talking about partnership. And then we also, Alana and I also heard from another tribe member who had this exact same conversation with law enforcement and other partners, but also business owners were in that conversation that this tribe partner had. And it had a lot of the same elements, all of these issues that were rising to the surface for people in the community and our tribe partners. And so we thought it was really important that we spotlight this work and then also bring a deeper level of understanding to some of the problems that are going to continue to occur just because of where we're at in our ability to obtain resources for people in crisis, but also because it's a difficult problem. So we continue to encourage you all to bring these topics up to us, to speak openly with partners and make sure to share this information. So who are we talking about today? Alana gave a brief intro to today's speakers, but I think it's really important to highlight not just the speakers that we're talking about, but the people that we serve. And so what I really want to do is encourage everybody to think about, we're going to be talking a lot about the responses that we have to people. And a lot of times our definitions of people are set up based on those responses. So we'll talk about crisis response, and Quinn might tell you a little bit about how people rise to the definition of really requiring a DCR. And Alia might tell you about, who might qualify for the R&P program. But I think it's important for us also to understand that the people that we're talking about continue to exist outside of our response. And so I think Alia said it really eloquently in the back conversations that we had in preparation for this meeting, that crisis is not just that moment where we interact with a person, but it is a moment that continues to exist, that, people will exist in that state of without housing or needing, to continue to have either a mental health problem or a substance use problem outside of our interaction. So I really just encourage everybody to think about crisis not as our response to people who are experiencing these difficulties, but for the people themselves who will continue to experience this with or without us. And so with that said, I am going to kind of elucidate, I'm going to ask our partners to elucidate this, the who for us by sharing stories. And so these stories were shared with us prior in our conversations in preparation for the meeting. And I thought that these two different stories would be really helpful because they speak to two people who I would say were in crisis, but had different experiences. One is probably going to continue to interact with the crisis system. The other one also may, but may not. And so I will turn to Rochelle. And Rochelle, if you could just share, this person, share a little bit about this person who who you shared with me had roughly around, when we spoke, 16 law enforcement interactions in the period of a month. And of course, de-identified and all that stuff, just really quickly, kind of what that looks like.
Yeah, so this person, they've had multiple welfare calls on them. So it's usually non-criminal. It's not dressed appropriately for the weather, doesn't know who they are. It's a combination of mental health, substance use. And so it generated approximately 16 different welfare checks within just a 1 month period. And this is somebody who has been at the top of every resource list in our community. And I'm sure some of you know who I'm talking about too, just because she's been so involved with all of us. So that was one in particular where we would make contact, we'd make the calls. Some of the systems are really great about showing up. What makes it more challenging is those after hours, so evenings and weekends where there's really no resources available to connect them. Right now we have that warming shelter that just opened up, but at the time we had no housing. So I think those are some of the challenges we faced the most with that individual. And Michelle, you'll have to remind me if you can give me a prompt of the second one that I told you about.
I think this, you all may not have been involved in this, but this one comes from Rena at Community Action, and Rena might be able to share whether or not OMAC PD was involved in the incident that she will share about.
All right, well, thank you, Michelle. This is a story, kind of an outlier for us, but on last week when everybody was snowed in and our offices were experiencing working remotely, I was able to answer the door, and a young lady had been released from the hospital, and she told me she was told to go to community action. And so normally this is not the kind of case that we've been dealing with through the pandemic. A lot of our assistants have gone to people who are filling out our forms. We're assisting them with housing and utilities, but she looked like she needed help. So I let her in, and she was not feeling well. I laid her down on the couch and started asking her some questions. We got her food. Find out that she was released from the hospital, treated for an infection, is fleeing domestic abuse, is homeless, and is 5 days free of opioid addiction, which she's trying to beat. So I had one case manager here that day, and I turned to her and I said, okay, well, who are our partners in the community? And we talked about a referral to the support center. We talked about other partners that we might be able to call on. To place her in housing ourselves would be bumping somebody from a waiting list, and placing her in a hotel with a voucher we didn't think was the right answer because it wouldn't address some of the issues that she was facing. So we called Advanced Recovery Navigator Program, which is wonderful. And you all know I'm new to the community, so I'm learning what everybody does as well. And I appreciate this format, this venue, to learn some of that today. And their staff came down. What a great group, what a great agency, and talked to this young lady, and we all decided that she really needs to be in a substance abuse recovery program. A call was made because we don't have a facility here for that, and I think that's an issue for our community. A call was made, a bed was available in Spokane, and Advance transported her to Spokane the following day. I thought that was a wonderful partnership and an analysis of what this young lady needed. And I hope that she is on her way to, recovery and beating her opioid addiction, as well as getting the other support that she needs. And as far as what our agency is doing right now, we are still in pandemic mode, providing assistance for back rent and utilities. But there's a day coming where that funding for is going to go away, and we're looking at new models of working within our community. So this conversation is very timely in order to do better wraparound case management with our clientele. who need to be working on the 21 social determinants of health. So I would like to introduce Jen Harper, who is our new support services case manager. Jen, can you just pop on and say hello?
Good morning or afternoon.
Yeah,
Thank you for
Jen.
having me.
Yeah, we're super excited to have Jen here. She has 20 years of case management experience and will be helping us move into a new phase of working with our clients to not just help them find housing and pay their utilities, but also to be able to, do what we did that day for this young lady and try to figure out what resources she needs and to pay more attention to that. We're also working with, thank you, Jen, we're also working with more closely now with behavioral health and family health centers and Molina to talk about the possibility of doing closer case management on a few of our homeless clients. And we're still working on the details of that, but we're pretty excited about the possibility of that pilot to see if we can make improvements on for the outcomes on those individuals.
Thank you so much, Rena. And so I am gonna turn to, before I kind of highlight some of those shared elements across those two stories, I want to turn back to Rochelle from OMAC PD to share more context around the conversation. And Rochelle, if you don't have like a slide to share, you can just anecdotally share around the data that you're seeing in the call logs around like the proportion of calls that you all get that are non-criminal. You mentioned that in your story.
Yeah, so I did pull some of the data, and this is going to be countywide data because I wasn't able to get just OMACs for it. So the numbers that I pulled were a comparison from 2021 and 2022. We have intoxicated persons, 134 was last year and 83 this year. And this stopped on December 1st. So we still have another month that's not included in this data. Mental health non-criminal, we went from 27 calls last year to 58 calls this year. Suicide rates, so completed suicides was 20 last year. We're at 7 this year, but our suicide attempts were 156 calls last year, and we're at 143 calls as of December 1st of this year. And then I added welfare checks in here. That could be various things. So like the individual that I mentioned that generated 16 welfare checks, and it was associated to mental health, but some of them are more health related. So in 2021, there were 489 welfare calls for law enforcement in the county to follow up on. And this year we're at 578 welfare calls. And some of those require social services where law enforcement, that's who's called because no one knows who else to call to do that check, or they're unable to do the welfare check. But I know Tony Hawley could speak to it. That takes a lot of officers' time. And I'm just with the city of OMAC, but I know for county that could take them an hour out of the way just to follow up on that one welfare call. So total calls for 2021, so out of all the calls that they received, it was 14,407 calls, and we are already up to 15,158 calls this year for the county as of December 1st. And for the city of OMAC, as of December 1st, was 4,961 calls. So that's distributed between the officers, and then you take into account all of the reports they have to write with that. So it can become quite burdensome when they've got so many calls, not enough time to document, and they want to make sure they're doing a thorough job, which they do, but then there's no decompression time for the officers in between their call logs or call loads. And then with a smaller department, if there's somebody out sick, which happens, someone's on vacation, then you have to take into account officers are going into overtime. So they've already worked their 40 hours for the week, and now they're adding another shift to that on a fairly regular basis. So not just for our community, but also our officers, that decompression time, that time for them to separate from some of these hard calls that they're going to for their mental health. It's important that we find some resolution to this.
Thank you, Rochelle. And Tony, I saw that you joined the call. Sheriff Hawley is here with us today, and I do want to just, if you have anything to add, please feel free to share. You can unmute, or you can also just chime in the chat in terms of the proportion of calls that we're looking at that do require response outside of law enforcement, and that would benefit. Like, these are individuals who would benefit from responses that intersect with social services or that intersect with healthcare, hospitals, and other agencies. And Rochelle, you might have given that proportion. I think you kind of said the raw numbers, but do you have a sense of, like, it is, there's that huge proportion of time because those calls are quite time intensive. But I think when we last spoke, I think you put that proportion above 50%, I want to say.
Yeah, and I don't have those numbers specific. What we find is it's really difficult to separate criminal versus non.
Gotcha. Yeah.
Criminal, because it might be, and if you read into it, a theft could have actually been some sort of mental health thing. So it's really hard to pull that data accurately. I would say, just to add on to those numbers for the OMAC officers, Chief Christensen wasn't able to be here today, but he says kind of on average, an officer shouldn't have more than 250, maybe 300 calls in a year. And that accounts for going to the call, doing the documentation, any follow-up. And some of our officers are, I think we have one that's over 800 calls for this year. And then the other ones are up there. They're all over 300 calls. So that just really impacts the officers, the department, and it creates a more reactive approach to policing than a community-based proactive approach. So that's another thing that we're really trying to highlight and focus on.
Thank you so much for sharing all of that information, Rochelle. And so we're going to move on to the next section of our conversation. And I'm sure you all are curious about what are these programs that have started up in the last 2 years. And so we'll ask Rochelle Danielson from the core program. We'll also ask Alya Kidwai to share about Advance and their programs, and then also to share about any updates from OBHC around mobile crisis, and also the DCR in general, like how does the DCR respond right now? And then Rena will share from Community Action about how shelter programs kind of work in with respect to these services. So I'm going to turn to the questions, and I do have to screen share, so bear with me just 1 second. Sorry about that. Okay, can you all see my screen? Is it working now? Alana, do you see my slides?
I do. It's small on the screen, but we can read them.
Okay, excellent. Okay, so here we really want to touch on the elements active in our crisis response systems and the new programs. So new partnerships have emerged within the crisis systems, and so really we'll start with Rochelle, and just sharing in your own words what your role is in the system. And by your role, I mean law enforcement, and also your role with the core program.
Yeah, so I was hired in May to start up a new co-responder program for the city of OMAC. A lot of what I've been doing these past 6 months hasn't been as much of co-responding with officers for various reasons, but to write a policy and procedure around what this program will look like, writing grants to expand it and expand the life of it so that we can do more intentional work. And I would say also working to build up the trust and communication with the community, because if the people you serve don't trust the services that we're doing, whether it's how we handle a crisis response, then you're not going to have much buy-in from those in need. And so we're really trying to put more communication out there, work together with agency partners. So attending a bunch of the meetings and getting information. The recovery navigators have been a great partner. OBHC, we've been able to call and staff cases with. So when I do co-response, it's generally when there's been a call, so it's in a reactive state, and I go with the officer, and it's more doing case management, seeing if there's any services that we can connect them with in the moment. And then the other portion that I've been doing is I have access to the law enforcement database. So I review calls when the calls happen when I'm not working. And then if there's any follow-up needed, I can reach out to that individual, check in with the officers, see if there's a follow-up that they want to do, whether it's for a social service follow-up or if there's a crisis, to see if there's some services they might be interested in. So I'd say the biggest role in the crisis system is building those partners, and then trying to build this program so that it's sustainable, that we're not doing the same services that other people are doing. We want to partner with them, get people connected to the appropriate services without duplicating them, and just building that positive relationship with our community.
Thank you, Rochelle. And we'll turn to Alia. And Alia, if you can also speak to the role of Advance and also talk a little bit about 24/7 and RNP and what people in crisis can count on from Advance.
Yeah, you bet. I'm super grateful to be here. And Rochelle, the partnership between our two organizations has been just phenomenal. And it's been amazing to me how quickly we've been able to build in just a short amount of time. So Advance really hit the scene around January or February of this year. And the Recovery Navigator program was our first large project. So what the Recovery Navigator program does essentially is provides community-based care coordination or community-based case management services for folks who are suffering from a substance use disorder primarily. So there's not an exclusion criteria for folks who have co-occurring mental illness that need assistance as well. So we work closely in conjunction with Okanogan County Behavioral Health Care and also drug court and the sheriff's department, all of the law enforcement agencies across the county. So we're not specific to the OMAC and Okanogan area. We have an office in Twisp, and then we serve, of course, Oroville and all of our outlying communities as well. That Recovery Navigator program with a separate set of staff also serves Chelan, Douglas, and Grant County, in addition to Okanogan. But for the Okanogan County focus today, I think our partnership, with law enforcement has been crucial. The Recovery Navigator program was born out of legislation that went into effect in July of 2021. And probably the most notable of that was the Blake bill. Along with that legislation came the decriminalization of some of our possession charges, or maybe not decriminalization, but certainly a reduction in charge from a felony to a misdemeanor. And so law enforcement was then required to make referrals to Recovery Navigator programs that didn't yet exist. So here we are in 2022, finally existing and hopefully excelling in the work. We've got a full team of staff who are serving Okanogan County at this point. So what people can expect from the Recovery Navigator program specifically is that community-based case management. And Quinn said it best when we met a few weeks ago. He said, well, we've got lots of wonderful success stories about how people are moving through the continuum of recovery and how they're actively participating in the community. And either no longer intersecting with law enforcement, or the call volume of intersection has gone down because of the case management that your team is doing. But what exactly is it that you do? So the best way to put that is that we've developed a team of recovery coaches and certified peer counselors who have lived experience, who serve as resource brokers. So the goal is to have folks that can say, I've been where you are, I've done the things that you're doing now, I'm living proof that life can be different. And let me show you how to get there. And instead of traditional case management where we sit in an office and we make appointments for folks, we have a beat the streets model where folks go out and they intersect with the community where they're at. That might be under a bridge. Law enforcement might call us to the side of the highway, Highway 20. We met with the Forest Service outside of Mazama for some folks that were camping this summer to address their issues and really address those social determinants of health, the trauma maybe that they're experiencing in the moment, and how can we create a sustainable case management plan for these folks to help get them out of this cycle of crisis and into a more successful or productive lifestyle, whatever that might be for them. I want to give the caveat though for the Recovery Navigator program that it is 100% voluntary. So it's, Rochelle was talking about that specific individual who had, the 16 calls to law enforcement, and the struggle for our team was that in our effort to support law enforcement, sometimes we were coming on the scene and there was just nothing we could do because they were refusing services. We are not DCRs, so we leave the ball for, determining competency and that sort of thing in the court of OBHC. We're not licensed professionals in that way. And so, we can't force folks into services, which is sometimes frustrating for the people who are on the front line. And those of us sitting on this call, because we would like to help people, but not everybody wants our help. And so just the realization and the recognition that sometimes the thing that we have to do is intersect with them when they're ready. And we were successful, I believe. If Rochelle and I are talking about the same individual, we were successful for a while at some productive interaction, and then we've had some setbacks. And so what we recognize is that we've got kind of a wave of a continuum where we certainly have dips and valleys where we aren't having as successful of interaction with folks, but hopefully we're continuing to move them along that continuum of recovery. We also have some housing services that are super limited but available to folks who are coming out of inpatient psychiatric treatment. So long-term assistance, rental assistance for those folks. So a lot of work with our psychiatric facilities outside of this area, since they don't exist here for inpatient specifically. So Eastern State is probably our biggest contributor to that program. And certainly we work with OBHC in that way, because most of these folks are coming out and then being provided services through their team. And then, lastly, all of our programs are benefited by our partnership with Family Health Centers. So we are a subsidiary organization of FHC, and that gives our clients ready access to primary care, behavioral health care, the medication assisted treatment program through the OTN. So just really a lot of access to services. But the benefit of being voluntary is that we can take somebody through a true harm reduction approach. And maybe today they're not ready for an interaction with primary care, but we can get them a clean use kit. So, they're at less risk for contracting HIV or hepatitis. So maybe it's that we can address their homelessness in the way of providing a tent and a place for that tent to be that's not illegal. So they're not encroaching on, our private property populations or interfering with local businesses. So that's really what folks can expect from us. We try to respond to the field. And then the 24/7 approach started at the beginning of November, and it's a 24/7 commitment to receiving a warm handoff and attempting to intersect with the client who's being referred. So certainly that's law enforcement, of course, because they operate 24/7, and OBHC are our biggest contributors to that call log. But we've got a 1-800 number, and I'll put that in the chat here in just a little bit. But fortunately, we're able to receive those calls and receive that warm handoff that gives us maybe that timely information and some of those nuanced responses to our questions that we can't get through just a paper referral or a checkbox. So Rochelle's been great about that, even in the aftermath of a call, identifying where we might be able to assist somebody. And then hopefully what we're doing is leveraging our community-based case management in that we're not duplicating services with OBHC or with Rochelle, and that we're hopefully leveraging their programs to take care of folks who are maybe higher acuity in the areas that they specialize in.
Thank you, Alia. And I'm going to turn to Quinn Lantz from OBHC. Quinn, if you could share about DCR, a little bit about the DCR program, and then also the upcoming mobile crisis unit.
I can. So, I mean, I would encourage questions if people have questions if I miss something, but OBHC, many of you know that we've been transitioning, we've been developing a mobile crisis system. And prior to having mobile crisis, I would say that, well, everything we had was to respond to crisis within the framework of a DCR, a designated crisis responder. And in that context, as has been mentioned here, Aaliyah, I'm kind of, I can really kind of empathize with what you're talking about voluntary. It's such a critical element, and I would say that 99% of everything that we do is voluntary as well. And the thing that sets a DCR apart is that they have under very, very defined, and what I would say is a fairly narrow set of circumstances, they're able to initiate a detention for somebody, which is essentially to keep somebody against their will in their best interest while they get very, very acute treatment. And that was the model that we had. We have been able to hire and train a team of people who I'm calling crisis technicians who are able to go out into the community. They can go to the emergency rooms. They largely have gone, actually at this point all over the place. So we're out on the streets, wherever somebody has reported that. We got a call today from law enforcement about an individual that was on a particular street. So we just went and found that individual. What the newer model does for us is broaden the definition of what is a crisis, really. So the definition of a crisis, and I'm definitely speaking too simplistic here, but the definition of a crisis for a DCR is very, very consistent with danger to self or others or grave disability, so, and that would be, essentially most of the time, that's kind of the traditional call about somebody who's suicidal. Everyone knows that a person can be in crisis that doesn't include those elements. I mean, you don't have to be suicidal to be in a crisis. But at OBHC, our designated crisis responders and our crisis system is designed really for that really, really acute system, and for us to be looking at how do we protect somebody either from, themselves or to take care of them when they can't take care of themselves. So with a crisis responder, we can go out to somebody and they don't necessarily have to be a danger to self or others, and we can engage them, So, just coincidentally, again, just today, we got that call. And so I can send our team can grab up a little bit of food and a little bit of water and go and introduce themselves to somebody, engage them, see whether or not there are opportunities to support them, within what we have to offer, essentially. So our mobile crisis folks are in continuous contact. They're always supervised by a mental health professional, usually a designated crisis responder. So for here at OBHC, it's a very, very close team model, so that somebody's always ready. They're also able to enroll somebody into OBHC services. They can invite people into those services. I think that kind of captures it. So it can go in both directions. We can go into the community and meet with somebody who is in crisis. We might be able to de-escalate that crisis and talk about the services that we have to offer, and then enroll them in our services, in which case that situation becomes, the crisis, elements of crisis are reduced, and that's good. Or, again, I can think of an example last week, a very, very similar situation where we got a call also from, I think it was from law enforcement, about an individual that was in the streets, not literally, but standing on a sidewalk, and people were concerned. That person was not dressed appropriate for the inclement weather. So very, very light jacket, not prepared for the cold concerns. Our mobile crisis team found them to be not oriented. So, it became clear that person didn't know, couldn't identify who they were, couldn't identify, what was going on around them. So that's what we would call oriented. They were not really oriented to person, time, place, or context. And we were able to get that person then to an emergency room, get a DCR directly involved with that, and make sure that they did get the level of care that they needed. So it can go in either direction. Obviously, we always wanted to de-escalate, but mostly we just want to make sure that when somebody's in a really vulnerable situation like that, that they get the care that they need. So, and that's kind of us, right now. That's the thing that's going on in crisis at OBHC.
Excellent, Quinn. So would you say the mobile crisis is up and running right now?
Oh yeah, absolutely.
Okay.
Mm-hmm.
Okay. Outside of the DCR services.
Outside of the DCR services. So I don't know who's here because I'm in my office, but we have 3 full-time positions. I think 2 people went out earlier. I actually during this meeting had to step away for a minute. So and they came to just tell me that they're back. So I'm
Okay.
not sure. Yeah. And so so they're functioning. We're like everyone. We're always there's some turnover. And so we have 1 open position, but that has not limited us from being able to respond at all. So
Excellent. Thank you.
Mm-hmm.
And Rena, if you want to share, you can share when we move on to our crisis to care conversation, or you can share right now. Rena from Okanogan County Community Action. Would you like to share now with respect to shelter services and how quickly Community Action can respond to calls that you might get that would be considered on the acute end of crisis?
So yeah, thanks. We have and I'm still learning all the details of our program because it gets really complicated with our different grants that we're operating under. But we are what's considered, we're proponents of housing first, which is a philosophy of keeping people housed and keeping them from losing housing so that we don't have more people who are homeless and on the streets. So a lot of our work has to do with supporting individuals and families who are about to lose their housing. And we do something called rapid rehousing, which is supporting people with making sure that they don't lose housing. So when it comes to shelter clients, we are supporting people who need shelter by holding a contract with the farm workers housing at the end of Okanogan. the city of Okanogan. We have a contract with WAFLA for using their farm worker housing from November to March. Then in working out a contract with them, they'll take, they are limiting the type of clients that we place in housing there who need shelter to families and individuals who do not have, how do I say this, issues, severe mental health issues or substance abuse issues to the point that they would vandalize their facilities. And that has happened to us in the past in contracting with for sheltering with facilities, hotels, and other housing units, that it's very difficult to shelter people with who are destructive and have mental health issues who aren't getting support. So our sheltering is limited. We lost our shelter facilities in Oroville this winter because the housing authority there is using the property to build some single family housing units. So the trailers that we were placing people in during the winter have been sold. So we lost that facility. We are working to refer clients up to the homeless housing, the homeless shelter that's run by the New Life Church just up the street from us, which will take individuals, both men and women, between the hours of 7 p.m. or 6 p.m. and 7 a.m. But you have to come to the shelter sober, and you have to leave in the morning with all of your possessions. So that's just an overnight shelter facility. Community Action is also part of the Okanogan County Housing Coalition, and by working with partners in the Housing Coalition who are working on building housing and sheltering individuals. We also know that the support center, which Margot's on the call, can support people, shelter people fleeing from domestic violence. And of course, behavioral health has the Shove House, where there's some housing for people who are in treatment with behavioral health. So those are the facilities that we have available to make referrals to. It's very limited. We're not sure of the exact count of the number of homeless people in Okanogan who need shelter. A lot of the definition of homelessness also refers to teens who are couch surfing and people who are living in RVs that aren't hooked up to water or electricity. So an exact count is hard to pinpoint. We will be doing the point in time count on January 26th and working with hopefully all of you to assist with that. And that's a day across the state where people will go out, volunteer agencies will go out and interview and talk to the homeless on the streets and try to give the state an accurate count of the number of homeless in our community. We know it's not a very accurate count, and it's really important work though, because a lot of funders look at the state data and which is informing them of the number of homeless and what type of support services we need for funding in our community. So we hope that we're going to get organized around that and reach out to all of you to hopefully assist with that count on January 26th. So that's kind of the status of winter sheltering around here. We lack shelter of all kinds. We lack low-income housing of all kinds. We lack transitional housing. The work that we do at Community Action, there's always a waiting list, and we are trying to keep people prevent them from becoming homeless through the 15 plus grants that we're working under for support services and emergency assistance, which will cover rent, utilities, and some other services to keep people housed. We always seem to have a waiting list. And for example, with our LIHEAP funds, we opened up our waiting list on October 1st, and there are about 800 calls that come in to ask for utility assistance, and we start prioritizing that. So really our work is housing advocacy to keep people housed. And we do have some ability to place people temporarily in hotels and do some sheltering that way, but it's not enough. We lack hotel rooms, we lack shelters, we lack all kinds of housing, low-income housing in our community.
Thank you, Rena. And I want to give a shout out, repeat the point in time count as a tool for tracking and also as a tool for community partners. Many people intersect, hospitals, clinics also intersect this population, and to also give a shout out for the coordinated entry system. Community Action is doing work on the coordinated entry system. And so I don't know if you or Jennifer want to drop in the chat kind of a connection if anybody wants to connect around coordinated entry or hear a little bit more about coordinated entry. But essentially, it is a way for people to be put on a list so that community agencies can become aware of those acute crisis situations that intersect housing and homelessness. Okay, so I'm going to turn to the next topic, which focuses on our gaps in the crisis response system. And the questions here are around, what people in crisis need from, not just from you all in the crisis response system, but also if you can speak to what people in crisis need from the tribe partners that we have here on the call today. And so I think we'll start with Alia for this one.
Sorry, Michelle, I was just silencing my phone. Can you repeat that question? Oh, and now you're on mute.
What do people in crisis need from partners in the CHI that they're not getting right now? And also, if we really want our crisis response system to serve people well, what do you think, what else do you think they need when they interact with our crisis response system?
Oh gosh, loaded questions. We talked about this a little bit in preparation for this meeting. So I've given it a lot of thought. So in terms of what folks need when we're intersecting with them, sometimes they need us to meet their immediate need. And Rena, I just want to share your, you didn't express it as frustration, but sometimes it's our frustration that there is such a lack of housing resources. So even when we sometimes have the funding through our various grant programs to provide shelter, we aren't necessarily able to provide that in a meaningful way quickly. And so I have said this at a couple of different meetings now, but when Michelle and I were talking the other day, I said, it's really difficult to address somebody's substance use disorder or their mental illness if they are not sure where that roof over their head is coming from and a safe place to sleep. And if they haven't had a hot meal in sometimes 3 or 4 days or a week. Sometimes they haven't had a meal at all and they're just, living off of whatever they can scrape together. Or we had a person the other day who was melting snow for consumption. And so, really trying to address those primal needs first. Like, how do we address the primary need quickly? So we've come up with a few ways, and one of them is a partnership with our local hotels. But as Rena was alluding to, oftentimes there's still a barrier because of prior vandalism, or they're on a list that, when their mental illness was untreated, they had had law enforcement interaction while they were in that hotel previously, and now they're on basically the no-fly list for hotels. And so it's sometimes difficult to place folks. But the one thing that we've been successful in is at least getting people a warm meal. And then we're fortunate through the Recovery Navigator program to have access to a van. So we are able to transport folks to the shelter if we've intersected with them early enough in the day. The barrier also being that then they have to be sober to be there. So the other resources that we're utilizing that are working right now are providing They're a dry suit essentially, so they're not an insulating piece of material, but they're a suit that goes over the top of somebody's warm clothing to keep them dry. So oftentimes folks are sleeping on the ground. So we're trying to address, how do we keep people warm? How do we keep them out of the emergency room for non-emergencies? Because what I know from my prior life is that these folks are seeking care through the emergency department because it's a warm place where they can sometimes have access to food and beverages. And so how do we combat that? So that's one of the things that our team is focusing on right now. So gloves, hats, emergency blankets, distribution of those to folks who are experiencing homelessness. And then, what do folks need in the future? And, we also talked a little bit about this in preparation for this meeting. And from a personal perspective and from an advanced perspective, where we're really doing community-based case management or care coordination, what folks really need is for us to continue to have strong partnerships. So I think the CHI does a beautiful job of illustrating why Okanogan County is sometimes stronger in this work with less resources than other communities, because look at the people who've shown up today. So applaud yourselves. I know it doesn't maybe feel like a lot to be here, but it is. This is a really big deal. And as I've now been exposed to some of the other communities across Washington state, I can say that Okanogan County is doing it right by bringing us all to the table, by having these tough conversations and some of the one-off offshoots that happen from these larger meetings. And so I'd just like to continue or to encourage us to continue to have those one-off conversations. So, Quinn, when you reached out the other day and we were able to meet, Rochelle, the fact that you are able to meet with our team so often, and we're able to address some of the barriers that exist between our organizations that maybe we can't overcome, right? 42 CFR and HIPAA and some of these other things that sometimes are barriers to us collaborating for a certain individual. Even though they might be a barrier for that individual, we've been able to address those for future interaction between organizations. So I think that what we need to do is continue to collaborate. And I know that in some ways sounds superficial and very lofty, but I think that we do the real work in that vein. And so just continuing to have those conversations and saying to then our funding partners, here's the barrier we've identified over and over again. And is there a way that you can help leverage change? And maybe that's through legislation. Maybe that's through, some advocacy work. Maybe it's through funding a new position, and maybe they know about additional grant funding that can help us with collaboration. But I think that there's a lot of opportunity out there for that. It does take time and it takes effort, but just the fact that everyone has shown up today and is doing this information sharing shows that we're committed to doing that work. So I think that's what we need going forward.
Thank you, Alia. Gwen, do you have anything to add to that response in terms of what people in crisis need from partners in the CHI?
I would echo, what Alia was saying and what a lot of people here are probably already really aware of. When we talk about housing, we really look at, the people's, just the social determinants of health. And when your basic needs aren't met, where will that person go? And I think that causes a lot of stress, so so if we have a person who's in this community who is now walking around, regardless of their struggle, behavioral health wise or in any other respect, if there's an uncertainty, and especially a great deal of uncertainty with where am I going to go, where can I go and be warm, or where can I go and get food, and that's a really, really big deal. And this there are not a lot of those resources here. And housing is a tremendously diverse thing. Again, kind of as Aaliyah has said, I can go here, if I'm sober, I can go here, except that I blew out of there. I'm not allowed here anymore. And so some of the people that we work with are struggling so much, it's difficult to kind of connect with them, and they're not easy to be with. A lot of times they're abrasive and difficult and clearly struggling in a way that doesn't let us engage with them, easily. So they're not necessarily a person, that someone's going to run out and say, hey, you should come sit down in here and let me have, get you a meal. And there's not a lot of those places. So there's not places for people to go. So we have a lot of people in this community right now who respond, so there are a number of people now, just even from this meeting, who are actively going out into the community when somebody's identified as in need. And then the follow-up, like, well, where will they go? And will it just be for tonight, or what's, how long is that going to go on? Is something that needs to be resolved. So your question here is gaps in the crisis response system. I think that crisis responders exist, and everyone is like, I'm here to help you find housing, but everyone's looking for the same housing that just doesn't exist right now. It's just not here. And so I wouldn't presume to know the answer to, then what is the answer, because it's never really, if the answer is simplistic, it's probably, not the right answer. I wish we had a much larger homeless shelter. I wish we had much more access to food, and none of the things that I just said really address people who in their own way say no thank you to our services. So when somebody's out there, and really in the throes of their own experience, behavioral health and trauma, and we want to genuinely go to that person and say, this is who I am, and is there anything that I can do to help you? They say in their way, no, go away from me, leave me alone. I don't, it's just a challenge. It's a big challenge. So I don't know what to say.
Thank you. I think you set up the next portion of this conversation really nicely, which is that there's the crisis response system. People continue to exist in crisis because we need them to move them from crisis to elements of stability, right? So that's the next topic of our conversation. But before we turn to our next topic, we had a question in the chat, and I actually think that this is a gap, and I want to allow people on the call to be able to speak to this gap, which is access to the current crisis response system, with respect to, Michaela is sharing the question. And Michaela, if you want to unmute to ask your question, I can also ask it for you. But it's specifically with tribal police and ambulance services. I think Advance spoke to that a little bit in our conversation offline, and like the attempts to work with the jail. But really, for this question, I think it's speaking to people currently in crisis, speaking to, are you getting calls, on your end at OBHC, calls, is there access, or is it something that there needs to be increased partnership with the tribal community and tribal police, or is that, is that happening pretty fluidly right now?
I know I take calls from tribal police. We take calls from the tribal jail, and we definitely work towards coordinating with tribal behavioral health. So and I'm not sure about the ambulance services, but all the calls come in, from various sources. Some of them come in from tribal police as well.
Thank you. And Michaela, do you have anything you want to add to that question? You're sharing that you're getting calls, for people, from people in crisis.
Yeah, so actually my baby just stopped crying, so I was unable to unmute. So I guess I'm just really curious about how people feel Is it well coordinated? Are there gaps between, like, okay, I have a tribal member, they're, you know, either in crisis and they maybe need access to some more culturally appropriate services, or like we're just not getting a response or anything like that, because we do have people, oftentimes women, a lot of times in domestic violence situations. Actually, we've had several of those. And the best that we can do is, you know, like give our advice and then refer, you know, to the services that we know of. But we also know that they're not going to take advantage of that because either it's too far away or they've heard, you know, bad things have happened to other people, whatever. We know how that whole thing goes. But I was just kind of curious if somebody could kind of speak to, from, you know, a resource themselves, like how they feel that coordination is going, and if we can maybe advocate on our end, you know, to tribal council or to somebody, for a stronger coordination of some sort, or, you know, anything like that.
Thank you, Michaela. Excellent question. And I definitely think you're speaking to a specific population that I could see, you know, probably wouldn't intersect well with the agencies that we have on the call today with respect to domestic violence, right? I think there's some hesitation in some of these situations around involving law enforcement. Advance might be more specific to substance use and mental health. But please, anybody of our speakers, please chime in to speak to that population, you know, women in domestic violence, or, you know, women in a sexual health crisis, or not a sexual health, but maybe sexual violence.
Well, I would defer to Margot, who I believe is in the meeting today. She's with the support center, which supports people in fleeing from domestic violence.
You know, we actually experience the same, what has been mentioned. Sometimes people from other cultures don't feel that our services are adequate for what their needs are. We have been trying to work with the tribe. We work very closely with the FBI and the prosecutor's office for the tribe to assist survivors of crime. And we do have people who are from other cultures other than the primary culture here in Okanogan County come to our shelter. And there's actually 2 people in our shelter right now who are Native American. But Michelle is correct. We have had times that, and part of it is the transportation. Part of it is that our county is so large. You know, we have put people up in a motel in Grand Coulee because they didn't want to come to OMAC. And that is something that we can do. It's not just our shelter that's available. We have other resources too. Sometimes we've, you know, put people up in Twist because they have a job there and they don't want to come to OMAC and stay in OMAC. And on the other hand, we've had people who came to the shelter who have taken the bus to work every day. So there are solutions to the problem, but it's also like Quinn said, sometimes people just they're not ready for that assistance, and they're going to find a reason why they can't use the resources they've been referred to. And so I don't know if I answered your question or not, but you know, those are some of the things that we can do for people is, you know, meet them where they are. Their children go to school in Tonasket. They want to stay in Tonasket. We may pay their rent for them or their utilities so they can stay in housing like Community Action does, the Housing First, to keep them in housing instead of them becoming homeless or having to come to the shelter. That's been one of our primary things lately, is keeping them in the housing that they have. And you know, if at all possible, removing the perpetrator from the situation.
Thank you, Margot. And I also want to share Rochelle's chat. Claire Harris, the behavioral health director for the tribe, wasn't able to make the call today, but in a meeting last week, she said there is an after-hour crisis line that isn't used much. And so I think that, Margot, if you can share in the chat the table that you host, that does include prosecutors and other partners, specifically around sexual violence and domestic violence. I think that would be a very useful table for partners to connect to kind of talk about that need and to chat a little bit more deeply about this topic.
Okay.
But if you could put that in the chat, that would be super helpful. So moving on to the next topic of conversation, we, and speaking to all of you, and you have all alluded to this already, that the crisis response system is just a portion of what we need in order to respond to people in crisis. The rest of what we need are resources and partnerships for anybody who wants to, anybody who's ready to move beyond crisis and get into, say, into a shelter or get into a position where they can be connected to somebody who can provide food supports and those kinds of things. So we're going to turn to that topic now. And because one of the shared goals that you all have is moving people out of crisis and reducing the number of interactions with law enforcement and other crisis response systems. So if you all can share how your agency takes people away from the crisis response system and introduces them to longer term supports. I think I'll turn to Rena first for this one.
Michelle, we lost Rena.
Oh, we lost Rena. Okay. Okay. Let's start with Quinn.
Okay. Well, some things come to mind for us. The one of the new things, of course, is something I think I already mentioned, which is our mobile crisis teams are able to go out, and do all aspects of enrollment into behavioral health services. So that might be a step, in a direction. The other things that we have, would probably two other things. Someone mentioned in the chat, that we have the show of house. So that is that's a far more planful, it's not really an acute service. So people going into the dorms and going into the apartments, I mean, they're all in recovery and they're all actively engaged in treatment, and that's a requirement to be in the show of house. So that is sort of a service that takes somebody, hopefully, from crisis into care. The other thing that we have that people may have known it as the clubhouse, so we have the clubhouse up here. And that has recently been changed. The name has been changed to the Highland Center for all sorts of reasons, mainly because the clubhouse is a model that's a nationwide model, and ours is not an official clubhouse, and so we don't want to mislead anyone. But and that is a place that we do have. So right now, people can come here, they can engage in skills development, they can have fellowship, they can get a meal, they can get out of the cold, and that's open. I think it's from 9 to 3:30, every day here at OBHC, and we're and that's open to anyone. It's not, you don't have to be an OBHC client, you don't have to be getting services from us. It's just, it's wide open. And just in the last 2 days, we've had I've had discussions with Dave McClay, our CEO, about really expanding those services, and really starting to offer opportunities for people to learn, additional independent living skills. So budgeting, cooking, essential kinds of things, simple things, anything we can think of that would help somebody. Then we're looking at doing classes. So we're looking at doing classes for, how to, we'll help people get their food workers cards. If people are more interested in that, we could help somebody get their food safety managers certificates, or we could teach somebody how to do laundry. I mean, it's really, that's just wide open. We're pretty open to suggestion. That's a service we have typically it's Monday through Friday, and that's been going on since I've been here. We probably don't advertise that enough, or we could get the word out more, I think.
Thank you, Quinn. So we heard a transitional housing model where essentially treatment is a required component. Alia, do you want to share a little bit about how your agency is taking people from the crisis response system and introducing them to longer term supports? And if you can share a little bit about what you shared with me with respect to why it is helpful to have the people in Advance specifically, like why is or are the people themselves who are working at Advance an added resource? And so by that, I mean the peer support specialists, the recovery coaches.
Yeah, you bet. So one of the ways that we're taking people through that continuum and towards long-term support is that we're meeting those primary needs and then addressing how they can continue to meet those in a sustainable way themselves. And so the reason that I feel like Advance and the recovery outreach specialists or peer support specialists are integral in that and are an added service to the community is because they're coming at this from a community-based perspective and not specifically a behavioral health lens, not specifically a clinical or medical lens, but really a community-based person lens, and working on that individual's needs outside of their behavioral health, outside of their medical health, and hopefully, the long-term goal is that will leverage some of our behavioral health and our medical health care systems and alleviate some of the load so that it's not a duplication of service, but rather a service that's provided from that community perspective. And so we have had some success in that regard, although I do know that there is some duplication of services, and ROIs or releases of information are really important because they allow us to duplicate less. So if somebody at Advance is working on housing for an individual, hopefully that allows Quinn's team to focus less on that, spend less time doing that work, and then just ask the question of the recovery outreach specialist or recovery coach who's assigned to that client. And once we're able to move them beyond that that crisis moment or that place on the continuum where they're experiencing crisis and help them get a job so that they're able to successfully start paying rent somewhere, or even if they're able to offset rental assistance from us, because sometimes we've got rentals available. It doesn't diminish what we were talking about earlier. The housing crisis exists and there just are not enough structures to put people into. But sometimes we've got private renters who are willing to rent to us. However, their rent is too high for the programs that we're running because they require that it be a competitive rate. And, we're in a community, whether we like it or not, or a county where a lot of folks have vacation homes. And so that drives our rental prices up. We are a destination. People want to recreate here. And so it limits the housing resources for our low income and vulnerable populations. So that being said, if we can help them along this continuum, get them successful in a job, and even providing support like gas to get to that job, or providing transportation to that job. Maybe it's not every day, but we help coordinate transportation for those folks. We can provide bus passes. We can, make sure that they've had a shower. We had an individual who was getting fired because they didn't have a place to shower. And they were living in their car. But they were in that continuous cycle because if you keep going to work stinky and somebody keeps firing you, you're never going to get out of it unless you have a place to take a shower and clean up. So now this individual's been with a job for the last 60 days and is starting to transition into a place where they can pay their own rent. So that's just kind of maybe a tangible example of how we're moving folks along in that continuum. Sometimes it's, that folks have enough financial support and housing support if if they can get clean and sober. So it's helping them along that path of recovery and helping them see a light at the end of the tunnel. In speaking to, you know, what Michaela was talking about earlier, it's really important that we have cultural competency and we're making sure that folks are intersecting with a program that's going to speak to their culture, and, you know, help maintain who they are, and not try to change that. So we're really fortunate to partner with Fire and Alexi and get folks linked up with, you know, culturally appropriate services. Sampoil has been a huge resource for us. The Wellbriety program, both locally and at a bit of a distance, has also been helpful. And so if folks can start participating in those programs, and specifically we're talking about people, you know, who are experiencing SUD, but if we can help them move along and start to become self-sufficient, then that case management doesn't just fall away. Like suddenly you've got a job and it just disappears. That's not how it works. And so folks stay on our caseload really unless they move out of the state. So, you know, maybe they're only intersecting with us once every 4 months, but they still have that resource and that lifeline if they need it.
Thank you, Alia. And it looks like Rena is back online. And Rena, you shared a little bit about how you all might not be a resource that people could come to in crisis, and you would immediately put them into shelter at Community Action. But if you can share a little bit about kind of if people are coming online, say a referral from Community, a referral from Advance, you know, what does that look like in terms of getting people to transition into stability by addressing social determinants of health areas? And if you want to share about current or new opportunities that you're looking at in partnership, community partners. Rena, do we have you or do we lose you again? I can move on to the next question. All right. Okay, I'm going to move on to the next question. So for Alia and Quinn, are there new or emerging opportunities that you want to share about today in partnership with jails, courts, or across sectors that you know, you're ready to share about? Alia, I'm looking at you, especially with respect to you know, your needs around jail partnership, and also the very promising work that you all are doing with the Colville Tribal Jail.
Yeah, you bet. So, you know, we're really excited that we're starting to intersect with folks before they come back into the community. So it's a bit of a reentry program, although I hesitate to call it that because there are full-blown reentry programs that focus on much more than just substance use disorders. But folks who have been identified in the jail as needing some peer support as they transition back into the community, they have full access to the recovery outreach specialist team or the recovery navigator program, both from the Okanogan County Jail and also from the Tribal Corrections Facility out of Nespelem. And we've been really successful at intersecting with folks newly. This is all in the last week and a half, but intersecting with folks that are coming out of that tribal corrections facility set for release within the next 30 to 60 days. And we're doing some pre-release planning. They're getting to meet their peer support before they exit the jail, which is fantastic, because instead of, you know, leaving there with no support, now they're going to leave there with a plan of where are they going to sleep, how are they going to eat, where are they going to get some clothes, you know, and how are they going to stay clean and sober, and what kind of support do they need to do that, medical or otherwise, as they come back into the community where potentially they were using. And so really important that we've gotten such a strong partnership with the Tribal Corrections Facility. And then the Okanogan County Jail has signed an MOU with our organization. The challenge in the jail continues to be staffing. And so there's been some inability to intersect with folks within the jail, but not because they're choosing not to participate with us, just because they don't have the staff to be able to sequester folks safely, take them out of that larger jail population and put them into, you know, maybe a room or a space where it can be a more private conversation. And so our team's gotten pretty creative, and they've been setting up home wave accounts with folks that we know are currently incarcerated and set for release. But we're hoping in the near not too distant future here that there will be some maybe like iPad availability where maybe it's not in a private space, but at least some availability to intersect if somebody is choosing to do that because they've gotten clean and sober while they're incarcerated. So I know that Quinn's team has intersection in those facilities as well. So I'll let him take over. But yeah, we're really excited about those partnerships, and we know that the Okanogan County Jail is working hard on getting staffed up so that we can do that work.
Quinn, do you want to share a little bit more about any new or emerging opportunities in partnership with jails, courts, or across sectors?
Outside of us doing the mobile crisis program, we don't have newer programs, and really, my efforts here and our efforts here at OVHC for the last, outside of that developing mobile crisis, have really been looking at trying to strengthen the programs we have that are existing. So I don't see anything on the horizon, in the immediate horizon, that's changing as much as it's really the existing programs themselves are adjusting to see, can we be just a little bit more dynamic or a little bit stronger and offer, a higher quality service, and looking in that direction. So we do offer services, crisis services and jail transition services. And so we interact with the Okanogan County Jail. I personally have had lots of communication with a tribal correctional facility up in Nisbelin, but it's not anything new. So nothing that I would say is a new program.
Thank you, Quinn. Okay, I'm going to turn to Jen Harper from Community Action. As Community Action is experiencing some internet problems, but Jen can chime in for Community Action. Jen, do you want to share a little bit about kind of a shift in modeling for Community Action in terms of how you all approach, people who are exiting homelessness or entering into housing stability?
Yeah, definitely. I can sure try. Please keep in mind that I'm very new to OCCAC just since October. Coming on, one of the reasons that Raina wanted me was because of my experience with case management. And we're really strongly looking at foundations of community supports through ALTA and DSHS as a way to do those more wraparound services and really work towards more actual case management and guiding people, helping people, answering questions to help them get out of the cycle that they're in versus just paying their rent or paying for this or paying for that, really working on goal setting and helping people find ways to get out of the cycle that they're in. With the pandemic, we had a lot of extra money just kind of thrown at us that to use to help people stay in their homes. And so that money is going away. So we really are going to have a shift in thinking, not only for our case management team, but also for our clients who have been able just to call us and get their rent paid or their electricity paid, things that we'll still be able to do, but we will be having to add a lot more of that wraparound case management. And I'm really hoping to work with the community partners more on meeting all of their needs and really looking at those social determinants of health and not just the one focus that we have. So I don't know if that answers your question.
Thank you. It does.
Thanks.
So I think the other thing, I don't know, Jen, if you know about this, we wanted we're going to put in a question into the chat for everybody to respond to. But in that time, I really would like to allow Community Action the opportunity to talk about a need that you all have, kind of an urgent need around food. Yes. Do you feel like you could share a little bit about that just very quickly?
If Raina is not able to, I definitely can. I see she's on here, but I don't know if she's able to.
I think it sounds. Yeah.
Okay, so I'll share what I know. A couple weeks ago, right before a meeting, we found out that I think it's Second Harvest dropped Okanogan County from their delivery. And so if I remember correctly, it was about 70,000 or 75,000 pounds of food that we will no longer have. And there was no warning. It was, your truck's not coming tomorrow. And so Michelle, who is our nutrition director, is working on finding ways to be able to provide the food and supports that we have been to people, especially going into the holidays where, you know, so much extra goes out to feed people over the holidays. And so losing this amount of food is a huge blow. I know that she's been working really hard and has actually received a grant that will help cover some of it, but not a lot of it. And she's reaching out to like USDA and other food sources throughout the state to help meet that need that we lost. It was huge.
Thank you.
Thank you. Yeah, 70,000 pounds of food. It was right before a meeting when she found out, and it's just devastating.
Thank you so much for sharing that,
You're welcome.
Jen. And if anybody has any solutions, they can reach out to Jen Harper, Jennifer Short, or Rena. And if you guys can just drop your emails into the chat, that would be extremely helpful. And I quickly want to share Rochelle's answer to the question around new opportunities. So the core program was just awarded to expand their program, and they're advertising for a second outreach specialist, which will essentially be able to add to their ability to have those proactive responses as well as follow up after law enforcement contact. So we're gonna begin wrapping up our meeting, and to close off this section of our meeting before we turn to Alana, who's gonna give a quick housing update. I want to allow everybody who shared to this conversation today an opportunity to talk about what they're thankful for that we have now that we didn't have 18 months ago. And this is really to celebrate all the work that you all have done, because there is a new model in place for how people are responding in our community to crisis. And so please just feel free to get off of mute, people, partners who contributed to today's conversation, and say, what are you really thankful for that we have now that we didn't have 18 months ago? And we'll start with Rochelle.
I think just the kind of the shift in services of being able to go to people in the community, there's been some of it, but there's been a lot more. And then the partnerships that we've developed with the other systems has really been instrumental in being able to connect people to services. So I'd say definitely being able to go where people are at, and then that ongoing partnership with our other partners.
Thank you, Rochelle. Alia?
Oh gosh, so much that I'm thankful for. But really for the foresight of the Family Health Centers board and their the Family Health Centers leadership team, their senior leadership team that really dreamt up Advance and said, we need to react to what's happening in the community. And they heard the outcry for, exactly what Rochelle was talking about, an ability to respond to where people are at instead of asking them to come to a structured clinical space that for a lot of folks is intimidating for a lot of different reasons. And so they recognized the barrier that a clinical space presents, which I think is profound for primarily clinical organization. So just really grateful that they had the foresight, and then thankful for their backing to make Advance come to fruition and see us through the the trials and tribulations of creating the Recovery Navigator program. And then secondly, just to echo Rochelle, the partnerships have been incredible. And we are a very strong community and county, and we might be large and there might be a lot of barriers, but there's just been a lot of effort on the part of the people that live here and who are in leadership here. And so just thankful for the leadership and for the teams that exist.
Thank you, Alia. Quinn?
You know, I think I'm going to echo also what Rochelle said. I think the openness to developing relationships and partnerships in the community. So being able to call, you know, not just an organization, but to call Alia or to be able to call Rochelle. You know, I don't have to call, you know, some large organization. And then I think that that's what has made things better, and that's what's going to make us, you know, better going forward. So you know, the relationships between providers is really nice. It's helpful. It's encouraging.
Excellent, thank you. Jen, do you want to say something? I know you're really new. If Jennifer Short or Rena is on here, they can also share.
You know, like you said, I am very new, and so I don't know really what it was like 18 months ago, other than the fact that we were smack dab in the middle of the pandemic. I do know, I do want to say that seeing all of these names on here and all these faces, and hearing everybody talk, it really makes me hopeful for my ability to move forward in this position and work well with all of you. So I'm really looking forward to building those relationships and meeting everybody in person, and just, you know, doing all the good work that we do and continue to do. Especially somebody said how large our county is. Because I'm not from here originally, so it's insane how large this county is for the amount of people that are in it. So I'm really looking forward to working with everybody, and I thank you for having me.
Thank you, Jen. So I'm just going to wrap up with a quick summary before I hand it off to Alana, and just kind of reiterate the things that you all said. So ability to meet people where they're at, and that ability to be mobile. So to do outreach, but also to meet people where they're at with people who speak their language. And I definitely want to underscore the comment that Michaela had, which is that we still have room to grow there too. And stronger and connected partnerships, investment from family health centers to respond to people in crisis outside of the clinical space, an immense effort from leadership all across the county, and also local responsive referrals. I do want to share something from Crystal Eshelman, who facilitates the Crisis Collaborative. Everybody who we spoke to in preparation from this meeting really said the Crisis Collaborative has people in the positions that are communicating together at that table. And what Crystal is really looking forward to in the coming year is to create some shared goals and needs around kind of moving these greater systems problems forward. And so we do want to be able to drop Crystal's email into the chat, because Crystal wants everybody to know that that is an open table. And so if your organization or agency should be at that table to talk about these solutions and these problems, please do reach out to Crystal and connect with her. And she will get you added to that list. And she's going to be doing some work with that group to be able to kind of come up with these goals around how do we continue to grow and address these needs. So I will turn to Alana, and thank you all so much for speaking and having such deep conversations with us in advance of the meeting. Please, partners, continue to chime into the chat in response to the question of how you would like to see our community improve upon crisis response and moving people out of crisis. Thanks, everyone.
Thanks, Michelle. I'll make this real quick. I wanted to reflect back two kind of upcoming pieces for the CHI network. One is the point in time count that Rena mentioned in the end of January. It's such a tremendously important opportunity for Okanogan County to tell the story of homelessness out here in ways that bring in resources, that bring in investment, but also, I think, help our partners get the kind of recognition for the importance of their work. And historically, we have really struggled in Okanogan County to do a point in time count well and effectively because it's a tough setup to do that count well in the middle of winter time in Okanogan County and go to where people are at. So it takes a lot of people to participate. Really encourage Community Action Council, please lean on the CHI network. Let's get the message out and see if we can't make it a really successful point in time count. The second piece, going back to Community Action Council, is about the food shortage and just really wanting to encourage you, Jen, and everybody at Community Action Council to stay in touch with us and let us know through the CHI network how we can continue to support some of that work. That is a really, really big transition in our food system in Okanogan County. I just immensely appreciate you all for carrying that big challenge as we enter the food season. Sorry, the holiday season. A few quick updates from the Okanogan CHI that do intersect with this. One on our call today is Carlene Anders. Carlene Anders is going to be working with the Okanogan CHI for the next 6 months. Well, probably the next 9 months, carrying forward a really new and I think exciting project for us with the CHI, which is convening a table for housing partners, town, municipal government folks, private builders, nonprofit organizations to think about ways in which we can leverage, develop, and advance housing resources in Okanogan County. So Carlene's job is to actually build a model for some of this collective impact using some incredible examples across the country. So Carlene, you will hear more from, and she'll be working with the CHI for the next 9 months just to get that project up and off the ground. It's really exciting, and it will be countywide. And then lastly, you'll hear more from us in 2023 about the community health assessment that Okanogan County Public Health and its partners at the regional level are putting forward. And in 2023, the Okanogan CHI is going to be launching a big data project, which is very exciting to try to really lift up and tell a better story and bring more visibility to some of the data that helps us better understand community health needs and also coordinate our response. So more from us on that, and we'll be hiring some folks in the spring to make that happen. So those are our updates from the CHI. Thank you so much to all of you on the panel for participating. Welcome, Jen. Thanks for dropping in there. And thank you to everyone on the call today, police, law enforcement, sheriff's offices. Welcome to the new CHI members. We're feeling really fortunate to have this CHI network. Got a big year in front of us. Thank you, everyone. Thank you, Michelle, for facilitating.
Thank you, everyone. And happy holidays.
Happy holidays.